We're going to target the upper trapezius, and remember that with the trapezius muscle it is, trapezoidal shape, so you've got upper fibers, middle fibers and lower fibers. So the upper fibers are the ones which tend to be involved with neck pain and often are tight with neck pain. So we're in this position because we may well have already been doing some cervical spine techniques, or we may have been doing some fascial release techniques around the base of the skull. So I need to stabilize the shoulder whilst moving the head and vice versa. So I've got one hand beneath the head just cupping, so I'm not lifting the head and placing stress onto my hand. I'm just having my forearm down onto the block. The other hand comes across, and I've crossed my hands into an X grip, so I can push down with one hand and I can push across with the opposite hand. So I'm going into this position, making sure that my thumb is away from the subject's throat, and I can change the emphasis of the stretch. So if I hold the head where it is, I can then press down further on the shoulder rather than placing the stress on the cervical spine. Now once I'm in that position, the advantage of the X is that I can release my underneath hand, maintain that stretch, and then I've got access to the upper trapezius. So if I want to do gentle massage techniques, I can use my thumb. If I want to use trigger point release, I can use my knuckle. So I'm coming into that position, or I can run my fingers up here towards the spine. So I'm addressing that area of upper trapezius and sternocleidomastoid more freely than I would be able to in a straight position. So that's our upper trapezius static stretch.